Hey guys, thank you so much for joining me for part two of my interview with Dr. Becky Wolery. I just loved this interview, obviously, because I had a million questions. And after we got done, I was thinking, oh, I could have asked her like 50 more questions. But I guarantee you that there will probably be another opportunity to speak with Dr. Becky because she's just such a wonderful guest and always up for being able to sit down with me. So you guys sit back, enjoy this episode, and make sure that you like and subscribe on whatever platform that you're listening or watching us on. YouTube is where you're going to see the video. So make sure that you jump on board and become a follower of the next chapter with Tiffany. So without further ado, here's part two of my awesome interview with Dr. Becky Wolery. Thank you guys.
Kind of like this tension just melts off of them when they know that. So, reinforcing that they can come and talk, when they need to. Hey, I'm here for you. And I also think that we need to take the next step, which is, how you doing today? I'm going to pop in and see just how are you today?
Right.
And so if we take a moment and approach them, it can be really valuable.
Yeah,
For sure.
I think checking in. You mentioned that. I pride myself on checking in.
Oh,
I'm a
good.
big checker inner. That's my word.
Awesome. Checker
Yeah,
ears are great.
yeah. I was literally telling you a story before we got started about a friend of mine whose son
Yes.
just
Yes.
passed, and I waited a few days for the chaotic dust to settle, so to speak, because I like to be able to check in when they can actually engage and not be so surrounded by so much going on with other people and all that. So the timing was impeccable. And it was sometimes I think when I check in, it's crazy, Becky. When I check in, it's usually because I got prompted to check in.
It is true.
Yep. God has done something to say, hey,
Can I add something to
yeah,
that?
yeah,
Because we did talk about that, but we didn't
yes,
really go into that prompting. But I think some people, like, if you're Christian or not, to me it doesn't matter, because it's the light that is being shared with you to that prompts you to do something that's good, and where it comes from, it doesn't matter. But the fact of the matter is, act on it.
yeah,
Because anytime it's something good and the thoughts are coming in, act on them.
definitely.
And what is amazing when you feel a spiritual prompting and you start to recognize, if you have that connection, is that when you do act on it, you understand why you did. And
Yes.
then there's this amazing connectedness with you and your higher being and divinity, when you can, like, wow, I can see that we're being watched out for. Somebody's watching out for me, and somebody or using me to help somebody else. And
Yeah,
there's nothing more powerful in my mind than that. So
definitely. Yeah.
wonderful for you to
Oh,
recognize that and
I
act on
do.
it.
It's weird, and not weird in a bad way, but I love it and I feel that it's my job. Once that
Mhm.
it's almost like a tap on the shoulder of, "Hey,
Mhm.
hey, have you talked to so and so lately? You need to check in." And check in, and then it's usually more times than not it's, "Oh my
Mhm.
gosh, it's crazy that you just reached out. Wow, I am so grateful." And I listen. I listen. Now more than ever, I listen.
Mhm.
And it is I agree with you 1,000%. When you get that little prompt, whatever
Mhm.
you want to call it,
Mhm.
reach out.
Act on it. Mhm.
Reach out.
It's a thought. It's just a thought that comes into your head. And but there, I think the reason we call them a prompt that's different, because it's out of context, right? I haven't thought about this person or this thing, or why am I feeling like I need to call somebody, right? And
Yeah.
so that's definitely a prompt. And I love that you are all about it.
Yeah.
I joke around, because I being a Christian, I just say, yeah, God used to have to, like, slap me in the face because I didn't listen very well.
Okay, and you're like back and forth back. Okay, okay, okay. And now it's like a slight tap. All right. Yep. I'm
That's
on
much
it.
better. I
Grab the
like
phone
taps
and
better than slaps in the face.
oh yeah.
Go ahead.
Yep. And that just shows personal growth, you
It
know?
does.
That's what that is. And
Yeah.
acknowledging, "Oh, I'm not in charge of all this. I don't
Yeah.
have, it's like, okay, Jesus, take the wheel." Because
Yeah.
I sometimes I drive blindfolded or I'm blind like, "Oh," and then no, get back on track. And I
Mhm.
listen to the prompts, and
Mhm.
I love
That's
it. I
wonderful.
live for it. And to touch somebody in a moment. And I'm, if you stop and look around, and if people were paying attention, I
Mhm.
could name a dozen people right now in my circle, and I
Mhm.
call them in my circle because they're people I truly care about, that are
Mhm.
suffering. And whether it
Mhm.
be grief from a loss of a husband, grief from loss of a child, so and so's got cancer, so and so's somebody just passed, that
Mhm.
whatever it is. And it's so important that we check in. And
Mhm.
that can be the difference between that person having the worst possible moment or day and not hearing from anybody for days. And all of a
Oh, yeah.
sudden, there you are. And it can just completely change their mindset and their heart and their spirit. And it's boom, all of a sudden, you might laugh together, even in those moments. And that's something that I have learned in my life,
Mm.
that just because you feel like you need to be in that grief or that sadness,
Mhm.
they a lot of people think it's bad if
Mm.
you smile. I'm not
Mm.
supposed to smile. I
Mm.
It looks bad if I'm laughing. I shouldn't be laughing. Why not?
Mhm.
Why not? Because what
Mhm.
it does, it takes you from
Mm.
feeling like you're in the toilet in the worst of the worst
Oh,
to all
yeah.
of a sudden I'm elevated a little bit and I feel a little bit better. And that's because your body's responding to the happy burst. And that's not a bad thing. So to be able to smile and laugh in your darkest moments because somebody reached out, somebody said
Mhm.
something funny, it's okay. It's okay. And it's actually better for you. So if I can be that moment or that light, or somebody wants to dump on me and we commiserate, whatever makes them feel better at that moment,
Right.
that's fine, but it is very important we listen.
I just wanna say amen to that because that was
Yeah. Can I get an
beautifully
amen?
said. Amen. Yes.
I agree. Well, good. I just went off on that tangent, but, um
Just to say, Tiffany, everything that you just said is backed by research. And I
oh,
so I
yes.
just want to kind of reiterate the fact that you're 100% right in helping people step away from the negativity and the trauma that they're going through, because they can go from being sad because of grief, but if they don't allow themselves to step away from it, we're not going to forget, we're always going to come back to it, we still need to process it, but stepping away from it will prevent people from going into like a deep depression.
Yes.
And so it's really, really important to accept that that's a positive thing to do, because it's okay to be sad. Just because I can laugh and I can smile doesn't take away the fact that I'm very sad about what happened. And I need to still continue to process through my sadness, but sometimes processing it in increments, right? Not all
Yes.
at one time is much better, because we can work through the sadness. But when we get and hit a deep depression, that is much more difficult to work through. And so giving yourself an opportunity to have those good, because literally what you're doing with the things that you talked about, having social outlet and having a laugh, is you're actually bringing dopamine into the brain and serotonin that has been drained because of this, because of what you've been experiencing with the
Mm,
sadness, with the trauma. And so you're actually creating a chemical change to basically keep the depression at bay, frankly.
right. Well,
And
and not to
so,
mention when you're on that level, your cortisol is probably highly elevated as well, which
yes, it is.
is not good. So your dopamine's down, cortisol's elevated, you are a hot mess, and your body is going to kick into
Mhm,
some autoimmune thing if you allow it to
mhm,
go on for so long. It's yeah, and no, I'm glad you brought that up because I've done a lot of uh research, if you want to call it that, on dopamine deficiency
mhm,
or people that are addicted to dopamine and their cortisol's through the ceiling. It's not healthy, and we don't
mhm,
even realize that. We take for granted that this thing right here, this carcass,
mhm,
is meant to be beaten every single day, whether it's metaphorically or physically, and it's
mhm,
going to take it for long periods of time, but it's not built for that. It isn't. Those things, those elevations are meant for moments. Then
yes,
they go back down. They're not
yeah,
meant for nonstop. So it's,
Well, they can't, right? Cortisol increases with, as you said, trauma, stress, different types of things that people go through. And when our body kicks into fight, flight, or freeze, right, our autonomic nervous system kicks into gear and our blood pressure goes up, our heart rate goes up, our respiratory rates goes up, and frankly, we're cognitive foggy if we can even think in those moments. And your body will shut down
mm,
and it will completely shut down. And so if you're in these long episodes of depressive states, your body is going to respond and react, and it can react in many ways. It can react with psychological stress, like some people will start doing disassociation, for example,
yeah,
just because of what they've experienced. But it also reacts on a very biological, physical standpoint. Like we know people who get very, very sick when they're emotionally, mentally drained. They get physically sick because their
right.
body is just shutting down. It's a stress reaction. And they're
Yeah,
like, it's just like, hey, help me, focus on me now, take care of me. Right.
yeah.
So, yeah, 100% all the way.
It's great. I'm glad that you sidelined me because that stuff is really good information that a lot of people are not aware of. And I really and before we go on again, I really really encourage anybody listening to this to, if they feel like they're in that mode where you're constantly on high stress mode and concerned about anything going on inside the body that's an overreaction and it's overcompensating and you feel crappy, then go get some blood work done. Go get a physical, go get checked out because nonstop high alert and or depression from here to here, your body's not meant to sustain that for long periods of time, and there will eventually be health issues. So I'm constantly telling people this isn't healthy for you to be on like Mach 10 all the time because it's just a matter of time before something kicks in and your body is overcompensating and some autoimmune thing kicks in, something crazy happens. So I can't stress enough that people need to really focus on health from stem to stern, top to bottom, and especially the older we get, it's very important that we really take care of ourselves. And and we'll go on to the next thing.
I
So,
just love, I love stem to stern.
oh,
That is
from end
awesome.
to end, from
End to end.
yeah,
That's
end
brain to body.
yeah,
And
right there to your
perfect.
toes. Yeah,
I'm going to start using that stem to, I've not
stem
ever
to
heard
stern.
that. I've not heard that before. I don't know why, but that's
Oh,
wonderful
well, you can
because
borrow it.
I'm going to totally borrow that. I'm going to steal it, man.
Do
That
it.
was
Yeah.
good.
I didn't
Okay.
coin it. I didn't coin it, but I use it a lot because I think it's very important when you to really get out there what you're trying to say from end
Hmm.
to end, stem to stern, whatever. It's true because we have to protect our brains all the way through to our toes. It's just crazy what can happen. So, yeah, thank you.
And that was awesome. And
Thank you.
absolutely, again, it's that body mind connection, right? That's the term I've always
It,
used, is body
yes.
mind connection.
Yeah.
And and we were talking really about stress, and the stress response we know can create deficiencies in things like magnesium and vitamin B12 and omega-3 fatty acids that can really have a huge role in helping us to manage our stress response,
Yeah.
right? If you've been depleted, maybe you don't even need it long term. Maybe it's just while you're going through something.
Right.
But anxiety also, I just want to add on the stem part of it, the brain part of it, besides the relaxation and breathing techniques and all of those things are focused on the body, but the relaxation also focuses on the mind. And a big part of anxiety is fear-based, just fear
Yes.
of the unknown, fear of what's happening, fear, and what the mind says. And so really it's so key to also get into therapy or do self-help books or whatever it can to recognize what you're saying to yourself, because your brain is saying something that's sending a message to your body to get into this flight mode, fight, flight, or freeze mode, right? And so you really have to look at what is happening in the brain and what it's telling you to do. Because many people can go through highly stressful events and trauma and grief. And if their brain if they're not saying all this negative stuff to themselves, they'll get through it. You don't go through trauma and automatically have PTSD, right? There's
Right.
a lot of different factors in it. And a lot of it comes down to what we say to ourselves.
Yeah.
And so we really have to know that. My favorite mantra is calm the brain, calm the body, but I say it both ways. I say calm the body, calm the brain. Some people need more of a focus on the body. Some people need more of a focus on the brain.
Right.
Um, that negative talk though, because you can do everything. You can work on like breathing, work on your vitamins, work on all your physical. But if you're saying to yourself, this is too much, I can't handle it, right? You're not going to get where you need to go. And I'm just
Right.
giving you one example of what people might say. I can't handle this. I can't handle this. This is too much. What's wrong with me? What's wrong with me? You know, just those negative things that people say to themselves. You're going to, just those self-talk will kick you into that high stress mode. So
Right.
changing your self-talk is so important. So body and brain connection, so important, but be aware of that self-talk and what you're saying to yourself. And that goes across with so many different types of mental disorders, what we say to ourselves, how we understand things, how we perceive things, right?
Right.
And that's where really starting to take a look inside. What am I saying to myself? What is my core belief? And that is not, when I say core belief, we might think religious, but it really can be something simple as like, I'm not worthy, or I'm not smart, or I'm not capable, right? If that
Hmm.
is my core belief, can you imagine how it's going to affect my mood, how it's
Right.
going to affect my self-esteem, my self-worth, my self-concept? And so really recognizing what those core beliefs are, what we're telling ourselves, and then to work on reversing those, because
Yeah.
frankly, our brain lies to us all the time. It
It does.
absolutely does.
It's
Lies
crazy.
all the time, all the time.
I know. And now, do you know who Dr. Joe Dispenza is?
I do not know.
Okay, that's another great one. He is
I will
all
write
about, write that baby
it down.
down. Dr. Joe, I've been following him on this journey of mine for the last 2 years. And
Okay.
he is one of the first podcasts, or he's mostly a guest, and you
Mm,
can find him on multiple platforms.
mm,
But he is absolutely phenomenal when it comes to
mm,
rewiring the brain. All
mm,
about rewiring the brain. And he knows that we are nothing but an energetic, um, cosmic crazy thing going on here, just full of so much capability, and we don't even tap into a teeny
mm.
tiny drop of it. So
True.
he is all about some pretty crazy thoughts that this thing can do right here, and he's proving it all the time.
Mm,
But he is all about rewiring the brain. The reason why I
mm,
even brought him up, and so it's very easy for us because right now everything's wired the way it is, and we need to figure out how to start to undo the negative, like you said. If that's what's going on inside that head every day, your brain is hardwired to think that and remind you of it 25,000 times a day. You suck. You're fat.
mm,
You're lazy. You're ugly. You aren't worth a crap. Whatever it is,
mm,
because that's maybe
mm,
what you were taught growing up. That's what you were
mm,
told. Or maybe you had an abusive situation, whatever it may be. Or maybe you just have that negative mindset. But
mm,
there's nobody that's a lost cause when it comes to the
mm.
ability to rewire the brain. And it's all about practicing things, if it's meditation, if it's whatever. So you have to learn how to
We never
rewire
can.
it, and then it fires together.
Yeah.
Yeah.
Yes.
Yeah. So
Yes.
I love that. He is all about that. And I have really learned a lot from him because of stuff that I had to deal with and the constant barrage of what somebody else said
Mm,
about me just puncturing through my positive energy. And when
mm,
that starts to infiltrate me, that pissed me off. That
mm,
really pissed me off because I don't need to worry about what other people say. It's none of my business what they say
mm,
about me. What I need to do is focus on me. I know me. God knows me.
mm,
And that's all that matters. The people in my circle that know me, that love me, they appreciate and love me because they know who I really am. That's what I need to worry about. Those other people don't matter. But a person that doesn't really believe that about themselves could take things like that and start believing
mm.
it. And then
Yeah,
you're down. So it's all about rewiring.
it is. And
Yeah.
rewire. And that's why that's absolutely spot on. And what an amazing journey for you.
Mm,
That's just
mm.
beautiful to hear that you've
Thank you.
had you are like a testament of what I just talked about, because you demonstrated that, hey, I used to struggle with what other people think, right? And now I recognize that I don't need to worry about this. I know me, and and those that are important to me know me,
Yes.
right? And God knows me, and
Yeah.
so you've been able to eliminate that negative chatter externally, that eventually becomes internal, because when we hear it enough times, or here's the thing, we don't even have to hear it enough times. We just have to repeat it in our brain, because
Yes.
that repeating it in our brain is what's hardwiring it in. But
Yes.
this is anything, the research has shown that we can change. There was a belief for a long time, you can't teach a new dog, you can't teach an old dog new tricks, right?
Right. Right.
But they found that to be completely false. Our brain can be rewired. A common thing I hear, and there's two reasons for it, is people will say, well, this is just how I am. And part of that is a good statement, because part of that is like, accept me for who I am, right? And I get that.
Right.
I want to be loved for who I am. But it's also, I find, pretty much an excuse most of the time when people are actually saying it, because they're saying that, well, I'm just going to be this way. And
Accept
they're
it. It is what it is.
right, which is an unwillingness to identify that there's things that need to be changed, and an unwillingness to change, because there's nothing about ourselves that we can't change.
Right.
And nothing. I tell people, anything that you don't like about yourself, you can change. It's not easy. It takes a lot of work. When I say don't like about yourself, I mean things that are maybe negative, like
Right.
maybe I can I have these negative thoughts, right? I can change the negative thoughts, or I have these negative behaviors. I can change these behaviors. Or I recognize that even though I like me for who I am, maybe I need to work on interacting differently with different people, because that might be beneficial for them. And I can learn how to do that. I'm
Right.
okay. I can be open to changing me if it's going to benefit other people too.
Right.
And we can completely rewire our brain. And it is I've done it myself. I just
Yeah.
want to say that, because I had
Awesome.
negative chatter, and for a very, very long time. And I got to a point once where I just like, you know what? I was sitting there just laying in bed, feeling kind of depressed, and all this negative stuff, just the same old themes. I tell people they usually have negative themes. Identify your themes. So I
Yeah.
had identified my themes. I had a couple of negative things. And then one time I was just laying there cuddling up, trying to feel like I was comforting myself and just wallowing in my own pity, right? Because that's what I was doing in this case. And then I'm like, all those things that maybe people have said, or thoughts that I've had, or things that have happened to me that were negative in my life, I'm like, it's not happening now. The people are not around. There's nobody in this room. I'm here all by myself in this room. The only person that is doing this to me is me.
Right.
And when I finally took full responsibility, and I love that I had that experience, because I've really been able to help other people understand that too, because you have to take ownership of it. Yes,
Yeah.
other people can cause problems in your life, but you can take ownership of what you do with your thoughts, what you do with your actions or reactions, what you do with your behavior. And that is the first step. And it is the most empowering thing in the world, because you can change it. I got rid of all of my negative thoughts,
Mm,
and I really did. It
good.
took me time. It was
Yeah.
not easy. And once in a while they'll pop in again, but I'm like, I know them for what they are,
Right.
and they don't have any power over me anymore.
Awesome.
And I can therefore live in my happy space.
Yes. Yes. It's crazy what the brain can do. It is
Oh, it really
absolutely
can.
crazy what it can do. And I still fight like you. I mean, no matter this positive flow that I've always got going, and I purposely, keep these things in check as far as the every now and then
Good.
because I'm immersed in a situation where things can come in because
Sure.
of my mother might say something and you're just like, not today, Satan. I just kind of, nope, not gonna affect me. It doesn't affect me. It's okay. It's all right. And bounce right back. But, you know, in the quiet of the night, because I'm
Mm,
here by myself at this little
mm,
apartment, and there'll be times that something comes
mm.
batter ramming through, and you're like, where did that come from? That was out of left field. But it is
Sure.
so funny. It's like, okay, I couldn't have kept it out with, like as if I'm the the dam and the water's behind it. It's so funny.
Mhm.
It's like you couldn't keep it out no matter what you try. It permeates in, and then you just have to learn to get it back out. So it's not like you and I are saying, oh, you'll rewire your brain and you'll never think another negative thought or some crazy ass thing comes
Exactly.
flying through your head. And you're like, where did that come from? It'll happen. It doesn't matter
Mhm.
how well you rewire your brain. You're human and it will come through. So you just have to learn to, no, I'm good.
Right.
Back off. We're done. No time for this. No. And don't entertain it. Don't acknowledge it. Just
Mhm.
throw it out. So it's
Mhm.
just a matter of practice how to rewire, because you don't want that to be what what is able to infiltrate. You just don't need the negative. So, but it is a
Mhm.
lot of work. It's not something that's easy, and that's where people fail. It's like, well, it's so hard. Well, yeah, it's hard, especially. And I'm not the kind of person that's been in that for a long period. And I can't imagine you were that person that was in there for years and years and years either, because that's just not how you're innately wired, and same
Sure.
as me. But those people that have been in it for decades, I could totally see how it'd be a lot of work. But if you want it bad enough and you want to get through that and put that in the garbage with a lid on it and throw it away,
Mhm.
you got to keep working at it. So, and it's just your mind has a habit. It's got
Mhm.
a cycle that's been on for so long. It's not that easy to rewire, but it's worth it. It's absolutely worth it.
It is so worth it. And I just love that you acknowledge that it's different for different people, right? And it's definitely going to be more of a struggle for certain individuals. And I see that people who struggle, especially with like chronic depression, um, because your mood is down for such a long time and you feel so awful that it's hard to have good thoughts, right? And
Right.
your brain gets so programmed that way. And even when the mood's sometimes when their mood is so low, it doesn't matter what they do, they just can't change that. And I've just seen it happen many times. A classic
Right.
chronic depression I had with a client not long ago was everything was good in her life. Everything. I mean, good family, right? Good children. She liked what she did. So there was no reason for her to be depressed externally, right? There was
Yeah.
no negative environmental effects on her. But her neurotransmitters were so imbalanced
Mm,
that she had such a deep depression and nothing was working. And we were trying everything. I was trying all the behavioral techniques and
yeah.
the help techniques. We were trying the cognitive techniques. I mean, we were trying everything. And I knew she didn't want to try medication when she first came in the door, because she had tried it before and it had just failed her. And so it's just a perfect example of why sometimes it is much more difficult. And I just don't want to negate those that go through such
Sure.
clinical depression, right? For one, and at the same time, where medication has a place, because again, it's the last resort. We had done everything. I mean, behavioral approaches, cognitive behavioral approaches, biological, medical, you name it. We'd done all of it. And she couldn't get herself out of bed, right?
Oh, it's too
It was just
bad.
awful. Enough to take kids to school and come back into the bed. I mean, it was just really severe, even with supportive families. And I just have to say this one little thing because a lot of
Yeah.
people don't know about this. Um, Medication is so hard because it is such a guinea pig process too. And then oftentimes people are given the wrong medication because it's not like, frankly, it's not like it's somebody who has diabetes where you can like take their blood sugar levels, decide how much insulin they need, give them the exact amount of insulin
Right.
they need, and then they're good to go. You can't take a needle in your head, pull it out and say, okay, you are this low on serotonin or this low on dopamine. And that's why it's such a hard process to even find the right kind of medication that really will work, and then the right dose and the right amount.
Right.
And and so I highly, highly recommend genetic testing.
Mm,
And and a lot of times people don't even know that that's an option. The doctors don't tell them,
of
but
course.
genetic well, and part of it is hard. Sometimes it's insurances don't pay for it. And what I've learned is it takes two fails. So in other words, you've had to have a failure from trying one medication that didn't work and another failure, and then they'll pay for it, right? After
Oh,
two
okay.
fails, they'll pay for it. Why? That makes no sense. Just do
Yeah.
the test in the first place.
Yep.
So we had her do the genetic testing, and then it will actually tell you with your body type, because everybody's different, with your body type, biological, this is most likely what kind of medication is going to work and be the most effective for you.
Wow.
And it will
Wow.
list the specific. And so you go from, instead of, hundreds of choices out there, to maybe three or four that are
Right.
going to be the
That's
most
great.
effective. So you eliminated massive guinea pig process, and then also massive side potential problems with taking the wrong kind of medication, right? The side effects that you might have, being overly medicated, underly medicated, just
Yeah.
all those things. You've eliminated so much of that. Again, it's not a perfect science. It says most likely, but
Yeah.
this woman started on the medication. She changed. I met with her two more
Wow.
times after that. She changed. She's
That's
like, and
beautiful.
she just came into me crying, like, I did not think that I could ever be at this point where I could feel, you know, feel again, just feel
Yeah.
again, feel
Yes.
happy, feel positive feelings. So, so there is definitely a place for medication, but I, again, genetic
No,
testing is
that's
way too.
great. I think that's great. And, I had mentioned earlier that people can rewire, and I apologize because I neglect to think about because I am not that person,
Right,
so it's harder for
right.
me to, and I don't ever sit there and go, well, it's your problem. I'm not that callous and thoughtless to know that there are real mental health issues out there. And people such as your one client there, that was an extreme case. So yeah, I never want to take away from those cases where they are absolutely 100% an anomaly with their mental health, and well-being. But thank God that you dug deeper and had that genetic test, and that she's living a better life, because it's doesn't affect just one person.
No, everybody, the family, the
Everyone.
children, everybody. But again, what we've been talking about is spot on, because she was so depleted, right? Just like if you had no insulin left in your body, you're going to die, right? She's
Yeah.
so depleted that she needed something to get her back up to this level. But that's still only going to get her so far. She still needs to do the work to get here. So she still
Yeah.
needs to work on rewiring her brain. And that's the thing, you can. And then if you can move from here to up here, guess what? You're less likely to maybe need as much medication. I've seen people finally get up here and then gone off the medication or
Oh,
reduced it to half, because now they've built up the neurotransmitter, because you can build up those neurotransmitters naturally,
yeah.
naturally with things like laughing and doing things you enjoy and exercise, right? They will
Yeah.
naturally build up. But if you're so low and you can't even do anything, you need something to help to get that first step. But
Yeah.
do you want to only be dependent on that, or never be able to go up here, right? And that's where you still got to do the work. You're like,
Yeah,
okay,
that's
what is
great.
my brain saying? Because think about how long she was depressed and how hopeless her thoughts were.
Yeah.
And so the brain had been very much wired to a very negative thing. So she was better, but she also knew that she had, emotionally better, but she knew that she had a lot of work to do.
Yeah.
But again, high functioning person, so she could go and tackle a lot of this on her own. She'd already started the second week, already started doing some physical things, but she hadn't even been able to do. So she
That's
was
great.
doing the work. So again, it has its place, but we can't ignore the fact that we are this holistic human being, and we need to work on the physical aspects, and of course
Absolutely.
the brain, obviously.
Right, right. No, I
The
think that's
the
beautiful. I
inner
like it.
thought.
Yeah.
Yes.
I love a happy ending in the idea
Yeah.
that it gave her to get back. I don't know if you'd call it baseline, to get back to where,
Right.
okay,
Oh
okay, I
gosh,
know
yeah.
where to go from here. Now I got to do the rest of the work to get here. But then she was here. That would be a
Mhm.
gift, absolutely, to go, oh my gosh, we got it figured out. Now we know what to do. But yeah, I think that's beautiful, because I think too many people, especially practitioners in your field, probably don't dig deep enough, and it is full, like you said, you could have, instead of her having a choice of 3 or 4 medications, because you did take that genetic test and find
Mhm.
out what would work best for her, what she might be depleted in, whatever it is, and then
Mhm.
the other will just, "Oh, well, let's try this med. Well, let's try this med." In the meantime, she's
Yeah.
like, feeling like she's on a roller coaster, and everybody around her's going, "She's crazy," you know? I don't want to be around her at all. She's up one minute, down the next. So I think it's beautiful that you're willing to go down that road and dig deeper. Okay, that doesn't work. Well, let's go a level deeper. Well, that didn't work.
Mhm.
Let's go deeper. And I think it's important because you want people to have a happy life. You want them
Mhm.
to be able to feel baseline at
Mhm.
least, and then be
Oh, I
able to
agree.
go the rest of the way on their own. Because I
Mhm.
mean, I can't imagine. I can't tell you, Becky, this is such a weird thought, and it's just the way my brain thinks. I thank God all the time for being that curious little girl that has been curious since day one. Because my parents tell stories all the time about, I would take off and go visit neighbors at 3 years old, and they'd get a call. Oh, she's down here visiting. Just this curious little
Love it.
girl that went, it's never stopped. And that
Mhm.
curiosity, I think, has been a huge part of why I have such a high energy and
Mhm.
love for things, for people, for knowledge, and for why asking me. I'm curious enough to turn it inward and go, what the hell just happened?
Mhm.
Why do we feel this way? Why did that happen? Why do you think they said that? Or
Mhm.
whatever. And find it out. And then process of elimination, start to go, okay,
Mhm.
that's not useful for me. That person's not
Yeah.
useful for me. And keep moving forward for my own mental and physical and emotional well-being. And I'm so grateful for that. And
Mhm.
and hearing stories about that gal that you treated,
Mhm.
it hurts my heart to know, because I know I have friends, that deal with some depression and anxiety and stuff, and it hurts my heart to hear their stories and think, I mean, there's a lot of people out there that suffer like that, and I'm one of the lucky ones that has never been on any medication for anything like that, has never needed it, and is capable of regulating myself.
Yeah.
And I'm so grateful for that, because I hear stories like that and I think, it just breaks my heart. And they're out there. There's out a lot of them out there, and I'm so grateful there are options now more than ever to help these people
Mhm.
get regulated and live a happy life, and not ruin the marriage. And not that they purposely did it, but it
Sure.
will eventually be done, because that one person is suffering so immensely with yo-yo mental health issues. Who wants to be around that? You know,
Right.
Nobody.
Absolutely.
And your kids, and it's everybody, and people suffer in your peripheral, and it's just sad. So I'm very grateful that God blessed me with being born last. That part I'm really grateful for, and having the open mind and the open heart and energy
Yeah.
that I do. Yeah. Anyway, I just went on a tangent there, but
Well, and
um,
bless you with not only learning a lot, right, and your own pathway is taking the time to understand yourself and to get to a very healing point, for lack of a better word, right? When you go through a lot of things in life, and then to be able to help others and share with others, because normalizing other people, lifting them up, just those are so powerful. Normalization, when we share our stories and uh, with other people, they oftentimes they don't feel so alone, because we're not
mm,
the only ones that go through what we go through.
oh,
And
absolutely.
and so just the fact that you have a passion, I think you from a little girl were very social. And so now you take that and you use it, right? To reach
Yeah.
out to other people, and your transparency and being genuine is
Thank you.
is really a wonderful way to connect with people and build trust with people. And trust is really important when we are trying to build good relationships. And mostly when and also I should say, mostly is not the right word, when we're trying to help other people
Yeah.
and, and share with them. So I think that's wonderful. And every situation and every person is different and unique, right? And
Hmm.
what they deal with. And you've mentioned there are really lots of alternative ways to help people. I've had people come to me that have done all kinds of different non-traditional type of therapies and have talked to me about how much it helped them. And I just think it's wonderful that people find things that work for them. Because one thing is not a catch-all. Just like I always say, I'm
Right.
not the catch-all for a lot of clients. I'm not going to be the person that gives them what they need in the session. Perhaps if they're looking for different types of approaches, right? There's so many different approaches that people use. And so it's just
Right.
important to continue, though, as you have talked about, continuing and finding what does work for you, what you do need, whatever that approach might be, who that person might be.
Right.
Um, yeah, so important to find out because we're all different. We're all very
Absolutely.
different.
Well, yeah, again, from stem to stern, we're all different, and
Yeah.
we're depleted in things, and we're over whatever, things overproduce.
Mhm.
It's crazy that the percentage of us that are walking around normal are,
Mhm.
because of the from conception to
Mm.
now, the things that could go sideways and the
Oh my
things
God.
that could go wrong and misfire and all of that. It's just amazing that this thing works as
Yeah,
well as
right?
it does.
I
It's an
say that all the
amazing.
time.
Yeah, it's
Yeah.
amazing. I mean,
You're like,
we could have
"How?"
a whole other podcast on the fact that this is a pharmacy right here. You produce your own opioids. I mean, it's funny how everything is so,
Mhm.
God had a plan when this thing was created, and it was like, it's amazing. So, um, well, this has been this has been amazing. I keep saying that word, amazing. But I could go on and on and talk with you for another 5 hours. And
But you know
so,
what? We just may have to have another session
oh,
together.
I was going to ask you if we could. There's other subject matter we didn't even hit, and I don't care because this was great. It's totally perfect. And despite our technical difficulties yesterday,
Oh my
and
God.
no, but it all worked out because you realized that your internet provider needed to up some things for you, which was like, well, that worked out okay. So no, this was perfect, and I just can't
Work
thank you enough.
today. Yay.
I know. Here we
It was
are.
meant to
Yes.
happen.
I know, it was beautiful. So, I look forward to talking with you again, and we'll have to communicate on the backside about what the next one would be. I Even if we didn't have an outline, I think we would just go.
Oh my gosh, we so could. And I know you had mentioned a couple other things that I'm very passionate about too. So don't hesitate to hit me up about like social media and the effect on kids and
Oh, yeah.
even
Yep.
cell phones. I mean, there's a lot to be said about that. So yeah,
Yeah.
anytime. And
Okay.
I
There
have a
will
lot
be.
of topics I'm passionate about. So
Well, and I'm
absolutely.
okay. That sounds wonderful, Miss Becky. Thank you so much. And I want to put out there again that you can find Dr. Becky on YouTube. It's called
Dear Dr.
Dear
Becky.
Dr. Becky.
Dear,
Okay. So
because there's other Dr. Becky, so that's why we had to do the Dear Dr.
I
Becky.
like
Plus
that
people,
better.
well, and people can write in and I love that. I love to hear from people and be able to respond to them on a more personal level. So
I love
that's
that.
why I did that.
I
Yeah.
love it. Okay,
Yeah.
so make sure you look for Dear Dr. Becky. And I have seen your stuff, and I have shared it before, but I haven't shared it for a while, so I need to share it again. But
Ah,
I'm gonna link that at the bottom of our
oh, thank you for
YouTube.
that.
Yeah, absolutely. And yeah, don't forget to seek her out. And so thank you again, my friend. I really appreciate it. And
Oh,
let's
thank you, my friend, and all of those watching, right?
yeah,
Because
yeah.
yes,
And you and
that
I are definitely always into the next chapter, so it's kind of funny how there's it's a continuing novel that'll just be going on and on. We'll just keep flipping chapters, and I love it. So
that's
anyway,
right. The
thank you.
next adventure, I'll be
I
waiting to hear what yours is always.
Oh yeah, and I'll keep you posted. But thank you so much, Becky, and
Yeah,
I'll
thank you
talk
for
to you
having
soon.
me. This is wonderful.
Thank you.
Enjoy the rest of your week,
Thank you. You too.
month, year, all of it, all of the above, right?
Yeah, exactly. Thank you so much. Well, guys, like I said, it's a pretty amazing episode, both episodes with Dr. Becky Wolery. I am so grateful that I had the opportunity to have such an amazing conversation with her of all things of checking in, spirituality, how to calm the brain and body, how to rewire the brain, and to be able to have a fulfilled life. Thank you guys so much for joining us for another episode of The Next Chapter with Tiffany. Be sure to follow Dr. Becky on YouTube at Dear Dr. Becky. Make sure you subscribe so we can keep growing, and we appreciate you all so much. We will see you later on The Next Chapter with Tiffany.